And tonight, a supplier for IV fluid bags across the country says supply chain could be affected until the end of the year after their North Carolina facility was damaged during Hurricane Helene. Baxter International says that right now they are hoping to start distributing the fluids to customers at 60% over the next few days. They hope to reach 100% again by the end of the year. Our Josie Frost has more on what local hospitals are doing to deal with this situation.
We are working very closely with our healthcare facilities across the state to make sure we have sufficient IV fluids so that people can receive the medical care that they need.
The Department of Public Health's Dr. Edward Simmer this week on the impacts hospitals across the state might feel after Baxter International's North Cove facility, a major supplier of IV fluids, was severely damaged in the storm. After hearing about the damage last Monday, Lexington Medical Center secured other suppliers.
Where the market's gone, for right or wrong, is Baxter was a predominant supplier. And so we are in discussions with other suppliers and have already secured some additional supplies.
Dr. Brent Powers says patients won't see any change in costs or any effects on the quality of patient care, and that they're helping to conserve the existing supply by finding other methods to administer medicines.
One of the medicines we use to help women who are in labor, the easiest way or the quickest way to administer is typically IV. But we can also provide it in other mechanisms, either oral or by a shot, and therefore consume or conserve our IV fluid for other purposes.
Dr. Danielle Schur with MUSC says they're exploring other options to supply fluid, and they hope to get more from Baxter soon.
They believe that they can get us back to from a 40% allocation up to about 60% as early as next week. So we're focusing on both things. So conserving where safe and evidence-based, and getting and making new products.
Josie Frost, News 19, WLTX.
And in a statement, a spokesperson for Prisma Health says that they are implementing a conservation plan to make sure patients have access and are exploring other available resources as well. And as we continue